She was diagnosed with breast cancer at a very early age. And that means those patients usually have not such a good prognosis as when the patients develop cancer in older ages. But we were able to go through a very serious, complicated, but effective therapy that can give her a very good chance of being cured from her breast cancer. The therapy for any breast cancer patient, and especially the therapy that we use on Jessica, included the 3 different types of therapy that we use for the management of breast cancer. So you need to have the local therapy of the breast cancer, and you do that with the surgery and with radiation therapy. But nowadays we know that the patient needs to be treated systemically, that we cannot just concentrate only treating the breast. And that's when all these medications that we call systemic therapy play a big role in her chances of doing well in the long term. So we treat the breast, but we treat also the body. So she had to go through the 3 different types of therapy that we use in breast cancer in order to get the best chance possible to be cured from this disease. Every patient that deals with breast cancer needs to know that you can not only treat the breast, that you need to treat the body. Because unfortunately, if we treat the breast only, then we are going to fail and the patient will not survive. So in order to control the local disease, the breast problem, the patients need to deal with 2 different types of therapy. One is surgery and one is radiation therapy. In order to treat the rest of the body, as a whole body, the patients need to receive the 3rd type of therapy, which is systemic therapy. And when I say systemic therapy, I'm talking about chemotherapy or hormonal therapy, medications that will go all over the body and wherever the cells are will be killed. So every patient that is being diagnosed today in this world with breast cancer needs to consider at some point that will require the 3 different types of therapy that you need for the breast cancer treatment. Usually cancers that are seen in younger populations tend to be more aggressive than cancers that are seen in older populations. You need to keep in mind that for years, breast cancer was a disease of the elderly. And we saw the majority of the breast cancer in the 60s, 70s, and 80s. But nowadays we see it in younger patients, and yes, the majority of those cancers that we see in younger patients are more aggressive than the ones that we see in older patients. The majority of the young patients that are being diagnosed with breast cancer, if the tumors was what we call hormone dependent, the majority of those patients will have to take blockers of the hormones for a prolonged period of time. And of course, while those patients are receiving those blockers of the hormones, the hormonal system will not allow them to become pregnant. So it's very important when patients as young as Jessica was, that you deal with your oncologist and you find the right time to stop your treatment, because you need to stop it so their hormonal system will go back to normal. And after that, they can go ahead and proceed with the process of becoming pregnant. Importantly, and it's a very important point, is once they finish the pregnancy, they need to go back to the original therapy that they were placed before. We do not have a lot of experience because we don't have a lot of patients having babies after breast cancer therapy. So it's not a lot of data available. But from the data that is available, what we know is that going through the process of becoming pregnant and having a baby will not modify in any way or form the prognosis of their breast cancer to begin with. So that's the reason that today it's safe to say that if the patient wants to have a baby, needs to stop the medication, needs to go through the process, but needs to go back to the medication as soon as the baby is born. From the few data, from the few analyses that we have, what we know is that number one, the patients may stop the therapy and go for pregnancy and have a baby, and that will not modify the prognosis of the breast cancer, which is already set from the beginning. And number two, the cancers will not become, or they will not become more aggressive of what they were before. That's something that I talk with my patients all the time. When the patients are going through treatments, right? They go surgery, radiation, chemotherapy, block of the hormone. Suddenly, the patients come to a time that says, this is it, I finished my therapy. And then at that time is when you start feeling, God, I was fighting and fighting and fighting, and suddenly I finished my therapy. What I'm going to do? The tumor will come back, I'm doing nothing. And that's a very difficult part of going through the rest of their life, because there will always be the fear, oh my God, this cancer will come back. And I joke with my patients, because the majority of the time when they finish, they start calling, I have this pain in this nail. Do you think that the breast cancer came back? When it's not true. But yes, the patients have fear and they live with fear. But life is nice, because with the pass of the time, patients learn to live with this. And of course, it's always in the back of your mind, but the patients can go with their normal lives. Unfortunately, we see more and more these days younger patients being diagnosed with breast cancer.
Do we know why?
We don't know why. Part of that is not every breast cancer that we see today is associated with genes. It's only about 8 to 9% of all the breast cancer that we see that are related with genes, passing genes from family members to family members. And what we are seeing more and more is that in younger patients, those are the patients in which we see those types of genes that predispose them to develop breast cancer. Not everybody that has breast cancer has it, but the ones that has the gene tend to have the breast cancer at a very early age. When you develop this type of breast cancer at the age of 20 or 30 or 40, that's when you are starting your life. That's when you are starting your personal life. That's the time that you may be starting your family. That's the time that you are maybe being very successful in your career. That's the time that usually people want to have babies. So having the diagnosis of breast cancer in this very early age bring those patients not only the problems dealing with the therapies and the toxicities that we do every day, but deal with all the other social problems that come around, being fertility, one of the most important ones for younger patients. It's absolutely incredible, the support that we have here at UAB, because we know that we have to deal not only with the problems associated with the breast cancer and the therapies, but we need to deal with these all other social issues that are so vital in the life of the patients. Going back again in her case, fertility, that was one of the most important things for Jessica in her life. When we diagnosed her with the breast cancer, she was starting her life as a married woman. They just married before that she developed the breast cancer. And in her mind, that was one of the most important issues, more than thinking about chemotherapy. Am I going to lose my hair? Do I have to stop working? One of her main issues was, I want to be a mother. I really want to have children. And if I'm going to be receiving chemotherapy, I may jeopardize that. So that's one of the big issues. So that's one of the supports that we have here. We have a wonderful fertility clinic in which we send all these young patients that are about to start this trip of therapy for breast cancer or other cancer, because those issues need to be evaluated. But we have support for many other things, not only that help patients to go through the process and have the best chance of being cured. One of the things that I always still teach my patients, and I think that's a general important principle, is that when you are diagnosed with breast cancer or any other cancer, the worst thing that you can do is precipitate into a therapy without having the information required to make the right decisions. So yes, you cannot force these patients to make this about starting chemotherapy yesterday because you were diagnosed today with breast cancer without thinking about all the other problems, about thinking about fertility issues if the patient is going to receive chemotherapy, about employment when the patients need to stop working because they are going to receive therapy. All those issues need to be discussed before the patient starts therapy. And the problem is that we, and in general the public, we have that idea that if you don't start therapy immediately, you are going to die the next day. And the reality is that that's not true, that you have time. You don't have plenty of time, but you have time, period of 2, 3, 4 weeks, to make the right decisions in order to get the best you can in the future. So fertility is extremely important. Yes, it's a very close window. We don't want to wait 3 or 4 months to make a decision about that. But we need to use the time that we have to resolve those issues up front. That's the reason you need to talk to them very early on. You know, it's a very rewarding process. You know, I always tell my patients that my breast cancer patients are my heroes. You know, I'm not even sure that if I have to go through what they go through, I will be able to do it as a man. I think that the women have this mental power of making things possible. You know, going through therapy, chemotherapy, surgery, radiation therapy, times feeling sick, trying to work, trying to keep family, is very difficult, and they do it, and that's an important and very nice thing to see. Jessica is very close to my heart for many reasons, because she's a young patient that I met before as a professional, not when she was my patient. I knew her before. Then knowing that one of our nurses that wanted to be a nurse practitioner, wanted to work in breast cancer, got breast cancer, then helping her to go through this difficult process and to deal with all these issues, very rewarding. Finishing the therapy and knowing, God, I gave her a chance, or we gave her a chance based on research that she can be cured. And then the most rewarding part, you know, being a mother and help her to go through the process and the anxiety. Do I have to stop my medication for breast cancer? Will this affect my chances of surviving the future? And then achieving those goals, and then see her pregnant, walking through the halls in the clinic, and then having a wonderful, lovely baby is rewarding. It's amazing. It touched the heart of anybody. And she's trying to share this news with the world, and that is her generosity of her heart. She wants to show that you can do it, that you are a young patient and you can survive and you can have a family and you can keep with your life.